All right, buckle up, because today we're diving headfirst into the world of EMT pharmacology.
Yeah, it's kind of like peeking into that mysterious medical bag they always have, the one filled with life-saving medications.
Exactly. The meds that EMTs use in those intense, time-sensitive situations. It's all about the what, the when, and the how of using those medications effectively. It's high-stakes stuff.
Absolutely, and every second counts.
So let's break it down. What exactly is pharmacology? It sounds kind of intimidating, right?
Well, it's not as complicated as it sounds. It's basically the study of how drugs work, how they're made, what they do in the body, and how they're broken down.
So it's like the instruction manual for understanding how a simple pill or an injection can have such a powerful effect on us.
Exactly. And there are two key aspects within pharmacology, pharmacodynamics and pharmacokinetics. Those are two big words, but they're important to understand.
Okay, I'm all ears. Break it down for us.
So pharmacodynamics is all about how a drug interacts with your body. Think of it like a lock and key. The drug is the key, and it has to find the right lock, which we call a receptor, within the body.
So it's like a perfect match. The drug binds to that specific receptor, and that's what triggers a particular effect,
You got it. And then there's pharmacokinetics.
which is,
It's like tracking the medication's journey through the body, how it gets absorbed, where it goes, how it's broken down, and eventually how it leaves the body. It's pretty fascinating.
so it's like mapping the medication's adventure from the moment it enters the body until it exits.
Exactly. And things like how the medication is given, like a pill you swallow versus an injection, can impact its journey. Even a person's age or other health conditions can play a role.
It's way more complex than just popping a pill, that's for sure. But let's imagine we're in the middle of an emergency. An EMT needs to administer medication quickly and effectively. What are their options?
Well, they've got a few tools in their arsenal: pills, injections, IV drips, each with its own advantages and disadvantages.
It's like choosing the right tool from a toolbox, but the stakes are incredibly high.
Absolutely. And speed is often critical in an emergency. Intravenous or IV administration, that's where they inject the medication directly into a vein that's like the express lane. It gets the medication into the bloodstream the fastest.
But I imagine it's not always easy to get an IV line in, especially in those chaotic situations.
You're right, it can be tricky. Veins can be hard to find, especially if someone is moving around or scared or if their blood pressure is low. So, intramuscular injections, or IM for short, that's a common alternative.
So instead of going directly into the vein, the medication is injected into a muscle.
You got it. It might not be as fast as an IV, but it's still an effective way to get the medication into the bloodstream relatively quickly.
It's about adapting to this situation and choosing the most effective route based on the specific circumstances.
Precisely. And it's important to remember that EMTs have strict protocols they have to follow.
So they can't just give any medication they want.
Right, they're only authorized to administer certain medications, and they have to follow specific guidelines.
That makes sense. It's all about patient safety. So let's talk about some of these life-saving medications. What are some of the most common ones an EMT might use in the field?
Well, first up, we have the MVP of emergency medicine, oxygen.
Oxygen, of course. It's essential for life.
Exactly. Think about it. Your phone needs a charge, right? Well, our bodies need oxygen. It's the fuel that keeps our cells alive, especially in vital organs like the brain and heart.
So if someone's not breathing properly or their blood oxygen levels are dangerously low, oxygen is the first line of defense.
You got it. It buys precious time while the EMT figures out what's going on and how to best treat the situation.
Makes sense. What other essential medications do EMTs carry with them?
Another one is oral glucose, like those little tubes of sugary gel.
I've seen those. What are they used for?
They're a lifesaver for someone with hypoglycemia.
Which is?
It's when someone's blood sugar drops dangerously low and they need a quick boost of sugar.
Ah, so it's like jump-starting a car that's run out of gas.
Exactly. It's
Yep.
like giving their body a quick energy boost to get them back on track.
That makes sense. Now, what about heart attacks? I know aspirin is often mentioned, but how does such a tiny pill actually help during a heart attack?
Aspirin is fascinating. It's a pain reliever, sure, but it also has this amazing ability to prevent blood clots. And during a heart attack, when blood clot is blocking blood flow to the heart,
It can literally mean the difference between life and death.
you got it. Aspirin works by preventing those platelets in your blood from sticking together and forming those dangerous clots.
Wow, so a common over-the-counter medication can be a lifesaver in the right circumstances.
Exactly, and it works quickly, buying time for the patient to get to the hospital and get more definitive treatment.
It's incredible how something so simple can be so powerful. Now, what about those severe allergic reactions? Epinephrine comes to mind.
You're on the right track. Epinephrine, which you might also know as adrenaline, that's the go-to for anaphylaxis.
Yeah.
Anaphylaxis, that's a severe, life-threatening allergic reaction.
Right, of course. So how does epinephrine help in those situations?
Well, think of it this way. You know that fight or flight response your body has when you're faced with danger.
Yeah, your heart starts racing, you breathe faster, your senses are heightened.
Exactly. Epinephrine is basically the hormone that triggers that response.
So it's like giving your body a super boost when it needs it most.
You got it. In the case of a severe allergic reaction, epinephrine can help open up the airways, constrict blood vessels, and basically buy precious time for the person to get to the hospital.
It's like hitting the reset button on a serious malfunction. So it's essential for those life or death allergic reactions.
hmm
Are there any other essential medications EMTs use that we should discuss?
We definitely have to talk about naloxone.
Naloxone. Why does that sound familiar?
It's a medication that's been making headlines lately because it can reverse the effects of an opioid overdose.
Oh, right. The opioid epidemic has been a huge problem. So naloxone can actually bring someone back from the brink of an overdose.
It can be incredibly effective, yes. It basically kicks the opioids off those receptors in the brain and reverses the overdose.
Wow. That's amazing. It sounds like a game changer in the fight against the opioid epidemic.
It definitely has been. It's a tool that's saving countless lives.
But even with all these incredible medications, it can't be as simple as just giving someone a pill or an injection, right? There must be challenges.
Oh, absolutely. Gathering information is key.
Like what?
For starters, EMTs need to know the patient's medical history.
Like, do they have any allergies or are they taking any other medications?
Exactly. Because even something as simple as taking an over-the-counter pain reliever could have major implications.
Really? Why is that?
Well, medications can interact with each other. Sometimes those interactions can be dangerous, even deadly.
Wow, so it's really important for people to be upfront and honest with EMTs about their medical history and any medications they're taking.
Absolutely. Even if it seems insignificant, it's always better to err on the side of caution and provide as much information as possible.
So it sounds like EMTs need to be incredibly observant, almost like detectives, piecing together clues to get a clear picture of what's going on with the patient.
You hit the nail on the head. They're trained to look for any and all information that could be relevant.
That's incredible. It sounds like being an EMT requires a unique combination of medical knowledge, quick thinking, and excellent observation skills.
It definitely does. It's a challenging job, but it's also incredibly rewarding.
I can only imagine. And we've only just begun to scratch the surface of this fascinating world of EMT pharmacology.
Oh, we've got a lot more ground to cover.
Well, then let's get to it. It's amazing how much information goes into those decisions and how much pressure EMTs are under to make the right call every single time.
Oh, absolutely. It's a huge responsibility, and it's not something they take lightly.
Speaking of those decisions, let's get back to those different methods of delivering medication. We were talking about intravenous or IV access being the fastest way to get medication into the bloodstream.
Right. That's always the goal when speed is of the essence.
But as you said, it's not always easy or even possible to get an IV line in, especially out there in the field.
Exactly. It's not like in the hospital where you have all the time in the world and perfect conditions. In the field, you're dealing with a moving target sometimes.
So what happens when an EMT can't get an IV line established? What's the backup plan?
Well, that's where intramuscular injections, those IM injections, come into play.
So instead of aiming for a vein, they're targeting a larger muscle mass.
Exactly. Think of it like this with an IV. You're taking the express train straight to the bloodstream. But with an IM injection, you're hopping on a local train. It might take a little longer to get there, but you'll still reach your destination.
And sometimes that slightly slower route might be the better option,
Right.
depending on the medication and the situation.
Absolutely. A perfect example is epinephrine. Remember we talked about that for severe allergic reactions?
Definitely. It's often administered using an auto-injector, right?
You got it. And those auto-injectors, they're designed for intramuscular injection.
That makes sense. It's all about speed and ease of use in those critical situations.
Exactly. Auto-injectors are brilliant because they're designed to be used by anyone, even without medical training.
It's like those emergency instructions they have on airplanes. Anyone can follow them, even under pressure. So in a way, auto-injectors democratize emergency care, empowering anyone to potentially save a life.
I like how you think. It's a great example of how medical technology is constantly evolving, making life-saving tools more accessible and user-friendly.
Speaking of different ways to administer medications,
Hmm.
what about medications that are inhaled? We talked about oxygen, but are there
No,
others?
absolutely. We have inhalers, which are crucial for people with respiratory conditions like asthma.
Right. Instead of going through the bloodstream, the medication goes directly to the lungs where it's needed most.
Exactly. It's about delivering the medication directly to the source of the problem.
I'll admit, I used to think there was only one type of inhaler, the kind you puff into your mouth.
That's a common misconception. Those are the metered dose inhalers or MDIs, and they're definitely the most recognizable type.
So what other types are there?
Well, they're also small volume nebulizers, or SVNs for short.
Okay, so what's the difference between the two?
Think of MDIs like a spray bottle, giving you a precise dose with each puff. SVNs, on the other hand, they're more like those fancy humidifiers, turning liquid medication into a fine mist that you breathe in.
So two different ways of achieving the same goal, getting the medication to the lungs. Are there advantages to one over the other?
Good question. MDIs are super portable and easy to use, but you need a bit of coordination to inhale the medication at just the right time to make sure it gets down into your lungs. SVNs are a little easier to use, especially for kids or folks who are having a hard time breathing, but they're bulkier and need an external air source to work.
It's a trade-off then.
Exactly. And again, EMTs are trained to assess the situation and choose the best option for the patient.
Speaking of different ways to administer meds, what about those medications that are given through the nose? Intranasal, is that the right term?
You got it. Intranasal medications are becoming more popular these days.
Why is that?
Well, for starters, they're pretty much painless, which is a big plus, especially in an emergency situation.
I can imagine. And it's less invasive than an injection or an IV.
Exactly. No needles required.
Are there common examples of medications given intranasally?
Absolutely. Remember naloxone, the opioid overdose reversal medication we were talking about earlier?
Yeah.
Well, it can be given intranasally.
Really? So they just spray it up the nose?
Pretty much, it's absorbed through the mucous membranes in the nose and gets into the bloodstream that way.
That's amazing. So it's effective, easy to administer, and relatively painless for the patient. Are there any drawbacks or limitations to intranasal administration that we should be aware of?
You bring up a really good point. It's not suitable for everyone, especially if someone has a nasal injury or a condition that affects their nasal passages.
That makes sense. It's a good reminder that every medication and every method of administration has its own unique considerations.
Absolutely. EMTs are trained to think about all those factors and make the best decision for the patient based on the specific circumstances.
So much goes into it. It's impressive, really.
It is, and we haven't even touched upon the potential for errors.
Oh, right, because even with the best training and the best intentions, mistakes can still happen, right? Especially in those high-pressure situations where every second counts.
You're exactly right. To err is human, as they say, and even the most experienced medical professionals aren't immune to making mistakes. But in this field, even small errors can have big consequences.
So how do they minimize that risk?
Training, protocols, and checklists. EMTs are trained to double-check their work and to follow what we call the rights of medication administration.
The rights. What does that mean?
It's basically a set of guidelines to make sure that the right medication is given to the right patient at the right dose, through the right route, at the right time, and for the right reason.
It's like a safety checklist, a way to reduce the risk of human error as much as possible. But what happens if an EMT does make a mistake with a medication? What steps do they take to address it and ensure the patient's safety?
That's a crucial question, and the answer highlights just how important patient safety is. The very first thing they do is focus on counteracting any negative effects the patient might be experiencing.
So they address the immediate problem first and foremost.
Exactly. Then they immediately report the error to medical control.
And that ensures everyone is aware of the situation and can learn from it.
Precisely. It's all about transparency, accountability, and continuous improvement.
It's reassuring to know those safeguards are in place. And speaking of safeguards, let's circle back to the information EMTs gather before they even think about administering any medication.
Right, that information gathering, it's like laying the groundwork for everything that follows.
Yeah, it's absolutely crucial. Think of it like building a house. You need a strong foundation to support everything else. That initial assessment, those questions they ask, that's the foundation. So the EMT arrives at the scene, and they're trying to get a sense of what's going on. What kind of details are they looking for specifically?
Well, they need the basics, of course, allergies, past medical history, any chronic conditions the patient might have. But what's really key is the patient's current medication regimen.
What they're taking right now.
Exactly. And I mean everything. Prescription meds, over-the-counter stuff, vitamins, herbal supplements, you name it.
Wow, even vitamins and supplements. I wouldn't have thought those would be important in an emergency.
You'd be surprised. What seems insignificant to a patient can actually be a really important piece of the puzzle for an EMT. It's all about potential interactions.
Ah, so something they're taking could interact with the medication the EMT needs to give them.
Exactly. Or it could mask certain symptoms, making it harder to figure out what's going on.
It's like those medical dramas where they ask, is the patient on any medications?
Yeah.
And it turns out to be some obscure herb that changes everything.
You laugh, but it happens more often than you might think. EMTs are trained to look for those clues. It's all about connecting the dots.
Are there any specific situations where a patient's medication history is absolutely critical for the EMT to know, like make or break kind of information?
Oh, absolutely. For example, if a patient is on blood thinners, that's crucial information for an EMT to have, especially if there's been any trauma.
Why is that?
Well, blood thinners do exactly what they sound like. They thin the blood, which is important for preventing clots. But if someone's injured and bleeding, those blood thinners can make it much harder to control the bleeding.
Ah, so it's a delicate balance then.
Exactly. Another example is if someone is taking beta blockers for a heart condition.
What are those?
They're medications that slow down the heart rate, which is helpful for certain heart conditions, but
But it could make it seem like their heart rate is lower than it should be, even if they are in a critical situation.
exactly. Without knowing they're on beta blockers, an EMT might misinterpret the situation.
So much to consider. It's like being a medical detective. But sometimes, those detectives on TV hit a brick wall. What happens when a patient can't communicate their medical history? Maybe they're unconscious or delirious or just too scared to speak clearly.
That's where those observation skills really come into play.
So they're looking for clues.
Exactly. Medication bottles are an obvious one, but they're also trained to look for other things. Medical bracelets, for example, those can be invaluable.
Right, those can indicate allergies or important medical conditions.
Exactly. And sometimes, even something like the way a person's home is set up can give clues.
Really? Like what?
Well, if they have a lot of mobility aids, like a walker or a ramp, that might suggest they have a condition that affects their mobility. Or if there are a lot of pill organizers and medical supplies around, that can indicate they have a complex medical history.
It's amazing how much information EMTs can glean from their surroundings.
They're trained to be incredibly observant. It's all about piecing together the puzzle, even when some of the pieces are missing.
And sometimes those missing pieces are the patient themselves, right? Like if they're unable to communicate or are just too overwhelmed to provide accurate information.
Exactly, and that can be incredibly challenging even for the most experienced EMT. It takes a lot of patience, empathy, and communication skills to gather information from someone who's scared, confused, or in pain.
It sounds like being an EMT is about so much more than just medical knowledge. It's about having compassion, building trust, and being able to connect with people on a human level, especially in their most vulnerable moments.
You've hit the nail on that. It's a demanding job, but it's also incredibly rewarding.
I can only imagine. Well, this has been absolutely fascinating. I feel like I've gained a whole new appreciation for the complexities of EMT pharmacology and the vital role those first responders play in our healthcare system.
It's been a pleasure sharing them with you.
We've covered a lot of ground today, from the basics of how medications work in the body to the challenges EMTs face in gathering accurate patient information.
And we've only just scratched the surface. It's a vast and fascinating field.
It really is. As we wrap up, what are some key takeaways you hope our listeners will remember from this deep dive?
Well, first and foremost, I want to emphasize that EMTs are highly skilled professionals who are committed to patient safety.
They're not just out there winging it.
Exactly. They undergo rigorous training, follow strict protocols, and are constantly evaluating and reassessing situations to make the best possible decisions for their patients.
It's reassuring to know there's a method to the madness.
Absolutely. And second, I hope our listeners have gained a better understanding of just how much information goes into those decisions.
Right. It's not just about treating the immediate symptoms. It's about understanding the whole patient, their medical history, their medications, their lifestyle. Everything plays a role.
Exactly. It's about seeing the bigger picture. And finally, I want to leave our listeners with this thought. We've talked about all the amazing things EMTs do with the tools and knowledge they have today, but what about the future? As technology continues to evolve, What new and innovative ways might we see medications delivered?
It's a fascinating question. Maybe we'll have nanobots delivering targeted treatments directly to the source of an illness. Or perhaps we'll unlock the secrets of gene editing to prevent certain conditions altogether.
The possibilities are truly endless.
What an exciting time to be alive. Well, that's all the time we have for today. A huge thank you to you, our expert, for sharing your expertise with us.
It was my pleasure. Always happy to talk shop.
And to our listeners, thank you for joining us on this deep dive into the world of EMP pharmacology. Until next time, stay curious, stay informed, and stay healthy.